So, ladies and gentlemen, thank you so much for your time. Also, on a Sunday evening, to be there around and to be updated of the technology that we are promoting through a platform like these. Let me take the privilege to invite you to the session. It is 3D printing future in high precision sarcoma surgery. And I have the privilege to invite you to this particular session to also introduce you to Dr. Jayesh Bellare, who is the Institute Chair for the chemical department and also a scientist and a material scientist working with IIT Bombay, and also Dr. Jaimin Shah, who's an ortho oncologist, also would be able to share how these technologies have been benefiting, as in 3D technology has benefiting specifically to 3D printing in his practice for patients. So thank you so much, and may I now introduce Dr. Jayesh Bellare sir to kindly share his presentation, while I will also have Dr. Narayan Karne, who is the Honorary Secretary for Maharashtra Orthopaedic Association, also joining in. He's just joined, but I think he missed out, but we'll check. Thank you so much, gentlemen, and yeah, please sir. Thank you.
Okay, great. I hope my slides are visible. Shibu, can you just confirm?
Yes, it is, sir. Thank you.
Okay, great. Thank you. So, what we are working on in our lab at IIT Bombay is to work closely with a few maxillofacial and orthopedic surgeons to be able to make bone reconstruction scaffolds. And what is unique about this is these are for implant purposes. This is not for surgery planning. And these are resorbable. So these are materials that go away with time. They encourage the body to heal itself in some sense. They are osteoconductive and osteoinductive. And they are nanostructured thanks to the presence of nanohydroxyapatite, as well as other morphological structures, which I shall mention in the next few slides. And this is work that we've been doing for over a decade with several students and collaborators, some of which are listed on this slide. So in general, we work with a lot of resorbable materials for regenerative surgery, which are outside the orthopedic and bone area. Just 1 minute description of those. We make polymeric hollow fibers suitable for hemodialyzers, but then there are also scaffolds in which cells can grow. Therefore, we make hollow fiber bioreactors. These very tiny hollow fibers can be implanted into the peritoneum, loaded, for example, with islet cells, and this has gone on to a preclinical trial in a mouse model, which shows that normoglycemia can be restored by implanting even xenograft islet cells thanks to the immunoisolatory property of these materials. And then we are now working on a bioartificial liver of this sort as well. Besides this, we also work on nanostructured devices that are useful for closing holes in hearts, particularly PDA, ASD, nanomedicines, which come across in many systems of medicine, and several products for bone regenerative medicine, which I shall mention in the next few slides. So the kind of materials we look at, I mean, I won't motivate this because this audience is familiar with it. In fact, they are the experts. So I'll just jump to what we have here. We have these materials which are mimicking the bone in terms of their external shape, their internal structure, and even the chemical composition. So therefore, they are eminently suited for orthopedic repair, particularly of long bones, but others as well. There is a hard component as well as a soft component. The hard component provides some degree of mechanical support. The soft component encourages the osteoblast and osteoclast activity so that mineralization occurs, and eventually these materials are eaten up or they disappear over a period of time. So that's the uniqueness of this material, and there are of course numerous clinical applications, maxillofacial, orthopedic, and so on, which I will not bother about here. So the idea here is to be able to mimic the external shape of the defect that is created in the bone, to mimic the internal structure, whether it is cortical or cancellous, to mimic the trabecular structure or the osteon structure, and eventually at the molecular level to mimic the bone chemistry to the best extent possible by having nanohydroxyapatite. And also we use, rather than use collagen, we tend to use gelatin, which is a modified form of collagen in some sense, which works very well and works much easier to handle and work with. So what we do is to mimic the structural aspects as well as the biological aspects, right from a macro scale to a nano scale. And we use these bone scaffolds keeping in mind the structural features needed, which are the mechanical stability and the kind of interconnected pores. We keep in mind the materials that are needed. We avoid metals in our work. We prefer to use biodegradable polymers along with ceramics, and we make suitable blends and nanostructures of these by using a variety of fabrication techniques, including 3D printing, electrospinning, freeze drying, and so on, with the overall aims of providing good cell viability, good osteogenic differentiation, attachment, proliferation, and host integration, including vascularization. So these are some of the aspects which we like to stress. And the target specifications include macropores, the ability to degrade, the kind of strength needed, and the various clinical, keeping in mind the various clinical needs, including either standard or customized shapes, both the kind of biological cues needed, and numerous other clinical needs that are of course well recognized by experts in this area. So what we are trying to solve is what is really needed, and that is to provide both patient-specific 3D bone grafts as well as grafts which are of standard shape so they can be kept in stock, to provide a porosity and to provide a graded porosity, in fact, that closely mimics the structure right from the large size to the tiny size at the nanoscale, to mimic the biology. We provide the ability to add cells using PRP or anything else, including stem cells. Ability to have some degree of load bearing, not as high as metal, but some degree of load bearing, and the ability to biodegrade, while for customized bone grafts providing a reasonable turnaround time with respect to printing these from a standard workflow, which I shall describe in a moment. We have several products which are suitable generally in the field of bone tissue engineering. The one that has been approved for a pilot trial and has just concluded a first in human pilot trial is a material that is a bone void filler. It's a sponge that is useful for cysts, ridge augmentation, but also for any sort of cavity in the bone that has been extracted by the surgeon, because this is a spongy material. It can be squeezed and stuffed into a narrow neck opening that is present post extraction of the defect. We've tested this extensively, and I'll show you this in more detail in the next slide. Besides this, we also have fixation devices which are currently beginning trials in animal experiments. These are biodegradable bone screws suitable for anchoring hard to soft junctions. We can 3D print these, and now we are 3D printing some of these for long bone repair in an animal model trial. So the typical workflow we see here is to begin with a CT scan where certain area has a defect. We do the defect isolation in the lab, in the computer lab, have a skilled computer surgeon and sculptor who sculpts the model, and then we print this model with a hard and soft tissue combination. The hard part will bear some load, the soft part is extremely osteoinductive, and eventually provide a shaped scaffold which can then be used in the patient. The soft part of this is the bone void filler, which we have tested extensively in preclinical and now in clinical. Here are some micro CT data which show that on the treated side, when the defect is stuffed with this bone scaffold, and it requires no preparation, it just requires a stuffing. If the surgeon likes, it can be immersed in PRP, but not essential. And the treated side the critical size defect is filled easily, completely to a high bone mineral density, whereas the side which is untreated, although the body lays down bone, it is inadequate to bridge the gap, being a critical size defect. And although remodeling takes place, it's impossible to fill the defect, whereas the treated side fills it well. Yeah. So this data is what convinced the drug controller to give us permission, and we just finished a first in human trial for a bone void filler, and it has worked very well. The surgeon also found it very convenient in view of the format being a sponge format, and we hope this will be useful for you immediately. We are now beginning a pivotal trial, and we are trying to do a multi-center trial, and we seek your cooperation in trying to do this multi-center trial at some of the leading centers with whom you might be affiliated. So here are some details of that micro CT evaluation, which shows the high bone mineral density and quick healing that happens. On the biology side, we have good cell attachment, we have good mineralization, and the ultimate goal now is to be able to customize these to the CT along with the both hard and soft tissue components. So technologically, this is a challenge. We need to have the graded porosity trying to mimic the trabecular structure from dense bone to porous bone, and we do that with a customized 3D printer that includes some degree of post-processing. We use cryogenic printing followed by post-processing, and then we get at a microscopic scale, when we examine our scaffolds by electron microscopy, we can see that there is both micro as well as macro porous structures. The microporous structures mimic the trabeculae of and therefore these are very, very efficient bone scaffolds, and they can be they are spongy and they are resilient. You can see here that you can squeeze them down, and it can go into a narrow neck opening of a bigger cavity which is underneath, and therefore it becomes very easy to use as compared to a powder or granules, which are much harder to use. So some of these, the biology of this has been studied by osteosarcoma cell line to show that the cells can accumulate both inside and within the porosity, such that these cells like to go deep inside, and therefore there is very good osteoconductivity as well as inductivity. So these are some technical details of how we build these structures in the lab. Here are some typical defects that we have tried to make scaffolds for, and these are awaiting permissions for trial. So basically what we have is that we have the technical ability to and we have developed the workflow, and we have some approved materials which, together with newer techniques that we are now developing, will allow us to repair many customizable grafts and provide you with solutions for best patient care. Yeah. So I think this gives you a quick summary of what I had to say. So let me stop here and try and take questions, comments that you may have. Thank you.
It was an excellent presentation.
Thank you, Dr. Karnik.
Yeah, right. Yeah, and really, it will be a revolutionary one. The research team comes in close with the clinical team, I will say, and that also on a large scale, because 80% of the healthcare is given by small and medium nursing homes. So if they also come into this, that will be very much useful for even the common patient, common man, and it will be really great, helpful. We really look for, because what we want in sarcoma, we excise whole the tumor, but then after a gap which remains there, that is a great problem. Then we are trying allografts and so many things, and implants. I don't believe in the implant, because implant is it is a spacer sort of thing, and we are buying time for, because implants generally don't last for a long time, and it's different with the TKR or THR. But when you are using these large implants and long implants, that they don't last long. Only they allow the patient to walk for some time, but that is not the real solution.
Right.
It is just, you can say, the temporary arrangement till we come with some great research, and this is really helpful, because we want some scaffold on which the natural tissue can grow. That is our dream, because we just can't have natural tissue overnight. So that scaffold which you are providing, if it really comes useful, it will be a great revolution in the for the patients with are suffering from not only sarcoma, for that matter, for any bone tumor where we have to excise a large section of the bone. It can be benign also. For benign, it will be a new life, I will say. But for sarcoma patients, it will be, they can have the more period of the life in the for them. So it is, I really appreciate it, and I feel that it will be really very useful to the surgeons as well as for the patients.
Thank you very much, Dr. Karne. Those are very encouraging remarks from your side, and we'll definitely seek your assistance and your association, assistance, because yes, ultimately, our goal also, we sit in IIT, people think, "Arey, what do you do here?" Here is a case where we have done something which I think will help the common man in some sense, common man and woman, through surgeons like you who can really assist them when in their critical need, when there is tumor, as you said, whether it's benign or otherwise, but it affects functionality, and therefore I think we are in good shape. So I'll be in touch with you, sir, through Shibu, and we'll take this ahead. Thank you so much.
Thank you. That's great. That will be great. Yeah.
Thank you,
See,
Doctor.
everybody in the IIT also, they feel they are very good in their field, but they don't know what is required for medical field. And in medical field also, we know that we require something, but we don't know who is going to provide that. So I thank Dr. Shibu also for providing such a platform where we can interact together, and it will be better for the mankind.
Lovely. Thank you,
sir.
All. Thank you, gentlemen. Thank you.
Thank you, sir. It is always a pleasure, sir. I mean, we just try to be a catalyst in between and help respondents to connect. Expertise are yours. Thank you so much, Dr. Jayesh Ballari, sir, for your very detailed presentation and some great work that you're doing in this space. And also Dr. Narayan, sir, for your active participation, because as you rightly said, the association taking that interest is also very, very important, and you have been also a key respondent, having actively involved in 3D technology, and also want to learn and be updated, and also want your fellow community members also to be updated. So that's a motivation for the technology, and we've seen that throughout last 2 days, all the association heads from various different associations had actually participated, and office bearers from various association, name it AOMSI or the OPAI, that is Orthotics and Prosthetic Association of India, for Reconstructive Surgery, Maxillofacial Surgeons Association. Also, Doctor, the Association of Healthcare Providers of India, they are also looking at actively supporting our larger interest to see that how this technology can get a lot of traction when it comes to POC. Doctor, if you had also attended earlier sessions, if you remember, Dr. Girdhar Gyani, who joined, he has another responsibility that he's taken, and he's also been actively given a formal announcement yesterday that we will be working for 70 hospitals to begin with as a pilot project. So that comes with a clear vision for us to also have a point of care kind of a setup going forward, wherein research, development, material science, machines, technology, all of that will be it will become an ecosystem, ensuring that how we can look at offering patient-specific, patient-satisfactory, index, and actually also measure, how this can be activated in hospitals. So that's the larger interest. So thank you so much once again, Doctor, for your presence, and I'm sure throughout the session, it will be very engaging, and a lot of information will be able to gain. And as somebody who has been responsive in terms of this particular thing, I take the privilege to invite you as a session chair for this session, sir. And we will progress, and you have to also have your conclusions drawn towards the end. So that will also be encouraging for us to know, in which direction that we need to move, setting a pathway, sir, going forward. Thank you so much, sir. So may I request Vijay? Vijay is a technology respondent. He is also a design engineer with IMS Simpleware. Now, we all spoke about 3D printing and material science and various solutions. Ladies and gentlemen, and doctors and also students, now this is also very, very important that we need to have simulation softwares. So now is an opportunity for us to know about this particular detailed analysis through a team which is actually working on this and also have their solutions to offer. Vijay, you can start your presentation.
Thank you so much, Dr. Shibu. Good evening, everyone. This is Vijay from Integrated Microsystems, and I'm just working as an application engineer right here. And so much background in just processing 3D images and for the 3D printing related things. But there is something which works behind are the simulations that we work initially. Then we go for the printers and our models and the simulation on. So we are introducing ourselves as a image processing and segmentation software. What is the need of medical image processing? Basically, what we perform is we visualize and process the 3D image data taken from CT or micro CT or SEM images, where you can filter, you can segment your particular kind of images that is your input, and then you can perform various applications or simulations so that you can modify uh, your project or the model before the final segmentation. So now we had an acquisition which is called the input, and we initially went for the input and just go for the processing part, and then the visualization and the reporting part. So in the processing part, we have pre-processing where we perform some tools in the software like thresholding, grayscale values. These are some terms that we perform with the pre-processing part. Then we go for the segmentation part where we used to, let's say we had a pelvis or bone or femur, and you want to just segment or separate with the colors, with your area of interest, or you want to measure something, then we go for the segmentation part. Then detection part is there. Then analysis. In the analysis, we perform various kind of simulations, and then the final diagnosis happens with the result after taking from the software. So these are the various steps that we follow. That's the data acquisition, which can be contact or non-contact from CT, MRI, or micro CT, and then we process the data using our software, or you can go for the software uh, uh, if you want your model to modify in your way. Let's say you have codes or something, then if you want to modify those codes, we have the access for those data also. And the fabrications happens after the simulation. Let's say you want your model for the 3D printing, then you can go for directly for the 3D printing also. So so many let just we have a question arises why image based modeling comes. So this is the process of this is the basically pre-process of having something in our hand after doing for doing something. So this is called the capabilities of the software, where we allows where we just make happen to study your topology, structure, and the material which you want to perform, which your area of interest is, and based on that you can inspect and simulate your model. So we offer 3D image segmentation, then model generation, and the solutions for the scans like 3D models. And the process is very accurate in that, and the measurement and the stats you can go directly by measuring. We have some tools. I'll show you just in a while that how you can measure, how can you segment your particular bone or structure, how you can maintain the accuracy in that particular design using grayscales, and your high quality and the final application. So this is the various workflow process in the medical image processing, where we do the segmentation process. Then generation happens. In that in between of that, you can do the measurement, and sometimes it happens like we had a data where a doctor want to segment his bone for a patient, where he want to measure a particular bone density of that particular area. That's called area of interest. So we had the capabilities to measure that also. I just personally have shown to them how to measure the bone density, how to measure your volume, how to measure your various stats using these tools to go for your final model. So this is basically a workflow that we are having in the image format. And in the left side, you can see the pelvis and the right femur and the left femur, where we have something in the fourth quadrant. If you see, this is something generated by the software without any processing. So this is pre-processing part that software has generated with only the stack of images that we have inputted. So this is basically a micro CT format or the DICOM format that we have just input here. So this is basically the import formats that we yesterday also just have provided a look into that. We are for now we will be going for the DICOM part of images. But other parts also is available in here. So these are basically the general and the standard format that you can just go for your input or the import of your data. So this is something in that you can see the green and the blue and the red color. This is basically a segmented data after the pre and post processing part, where we have segmented. I'll just show you this part in a while. This red one is called the center line. This is one of the tools that we are having. We use basically in the arteries and the other structures, where we used to just modify our range of data by dragging these red lines, which is you can see in the artery. So this is also an interactive tool where your flexibility of stats and the wall thickness and other measurements also you can perform according to your convenience. And this is called our CAD workflow, where you can just go for these standard format called STL and other format also, and other tools for the flexible and your particular area of interest. And this is volume topography that you can see, where we have performed finite element mesh analysis, and after that we have gone for volume topography, where we have segmented in a different colors. In the same way, we can go for the density also, mass density also, where we can segment these mass density in a particular bone with these color. So that is kindly like attracting and smoothing in your model comes in front of you in the final analysis. So this is some of our automated AI based modules, AS Ortho and AS Cardio, where we perform some of the this left side in the bottom. You can see this is a mesh that we have generated, and this is a NURBS module that is also included in that. And in the last, you can see some blue and reddish lines. These are showing some velocity flow, where we perform. Let's say you want to perform in your artery, your blood flow, or any other places like in the rock or material, where you can see how the particular oil or the particular kind of air flows in a particular model inside that. So any questions from anyone's end? I'm now just going for the demonstration part of the software. So this is the welcome screen that we are having right here. And first of all, I'll go for the input part, how to import your DICOM images. So that is very much simple. You can scan your folder wherever you just have provided your data. Just go to that particular data, and after getting these inputs from there, just I have directly gone for the data, particular kind of data. So I'll just paste it here. I had the location already in my hand. So I just taken from that particular end. You just have to remember that where you have kept your data. Just put the finish button. Your data is here. This is you can see the slices. This is various kind of slices that we have taken from the input. So as of now, this is slices. First of all, we had the image processing. So for the crop part, you just have these options. You can just go for the crop by dragging these things like the ends, and you had these options. If you have worked on your particular data, just put your state of input, and just you can be ready with your edit. So now I'll be showing how to select the hard part of the tissue, because here a lot of soft tissue is available, including with hard tissue is also there. So just this is histogram. Basically, this is we have three options: histogram, profile line, and CT preset. Where in profile line you just go for the grayscale by using these curves by having a measurement kind of stuff, where you just go for your particular range of grayscale. Right now I'm just dragging these depend on my interest. So I'm just taken this, you can see this is taking whole. Now I'm just going for not for whole, I'm just going for few, whatever my interest is. So you can see that I've just selected some of that, and if you press apply, then your new mask will be formed. This is called fast preview. That you can you just see this like in the fourth quadrant. We have 3D view here. Just see, we have taken the using grayscale. We have taken our mask. So outline or the boundary has been generated over here. Now our work is to remove these small islands. These are the small islands that you can see. That is not our part, because in the final 3D printing part, if you want to just take this model, that will not happen, or you are not able to perform your accuracy. So for that part, I just use this tool called mask flood fill, where I'll be just having in my hand this big island. So I'll be just going to click on this particular big island. Then this will leave your big island, and the rest of your small island just have gone. So just let me show you one thing. It's my active mask and my 3D, so that you can parallelly see what is actually going on over here. So we have just removed our the small island that is not our area of interest, basically. So right now you can see we are having something in our hand that is pretty much accurate, but so much disturbances, or the quality is not that much good. So what we are going to do is, again, for the image processing, we'll do some parts. Let's say if you want to work on our regions, that is let's say we want to differentiate that all are same in the kind of color. We just want to differentiate one thing, that our femur will be having different color or something. So we had the preset option, where we are having some AI automatic options, where let's say we are working on the hip part or the pelvis part. So just take on the particular hip, just go for a boundary line. Now go for the right one also. So let's see what you will see, the sacrum part, and the left femur and the right femur also. So for the left femur, if you drag the outlines, it will show you after applying what is actually happening in that particular area. So the sacrum part also I will be taking. So when you scroll up and down, you will see the sacrum part also coming in our slices. So this is our area of interest right now. We have selected the sacrum part. So the sacrum part will be come out after you just make sure that you have just gone for that. So I'm just taking the boundaries over here. So no need to go for the very much accurate structure. This is basically kind of outline kind of structure. So just in a second you will see what happens, actually what we did. Yeah, so we have successfully generated our mask. So you can see we have our mask in our hand. We have right femur with a different color, and others also with having different color. I just have missed one thing. That's why this left hip also having the same color with the this bone. So this is basically a time consuming kind of stuff. Moreover, your time is here. Moreover, you're providing the time for your model, the more accuracy you will be getting after that. So after getting some of the point that we can see some gaps over here, just using some paint tools where you can just go for the slices. In that particular slices, if you cover your mask in that way, that just a second, if you'll see the boundaries are open in some way. So if you just close those boundaries, I'll be zooming my cursor. So this is not my area of interest, so I'll be taking right femur. This is the right femur. So if you close your area of interest, and the thing will be in your hand, will be like just a minute, will be kind of, this is the final that I have just created from there. So kind of a structure that you will be getting in our hand, that will be just a minute, I'll be showing you, not this model, I'll be showing you the model preview. I have just selected the right femur over here. Let me zoom to the 3D view. Here, after using that particular paint tool, I have just closed all the gaps inside that we are having right here in our model. So after putting some extra inputs like smoothing filter called recursive Gaussian, where we put our input, and if you want your particular mask to be accurate or so much smooth, then my selected part is right femur. So you can see the difference. The other parts, you can see the difference in other parts. Our right femur or the right hip we have just created is you can see so much smooth than the other parts. So this is the smoothing that we covers in that, and other options also we are having in our hand. So for meshing part, we have direct option over here. If you drag your part to the model section, you will have a pop-up called four pop-ups you're having right here. So these options, four options are surface model. If you want to go for the surface modeling, if you want to go for the FE modeling, then you can directly go from here, and CFT, and similarly the NURBS model. So let's say I just want to go for the FE model. So right now I don't have that much accuracy because I just worked on a particular single part. That's why single part is having that much accuracy from other part. So similarly, you have to perform on each parts one by one, so that you can get your access to the smoothness. And finally, if you get this called as mesh, this is just setup button. Then you have a few segments that tells you that how you want to perform your volume meshing, how you want to perform your materials, how your contacts will be, which axis you want to contact. Let's say if I will select then Z minimum, or if I want to show you the Z minimum, then possibly the Z minimum it will be showing to the femur. So let's say we just want our if you want your tetrahedral as well as triangular models, then you can go for the FE grade. And if you want for the tetrahedral only, so you just go for the FE free options. And here your mask coarseness, where your final FE will be your mesh part will be having the particular kind of coarseness, where you can reduce, or you can just by pressing this or putting your input accordingly, you can reduce of coarseness. And if you want your other materials to be specified, we will just go for the placeholder. And if you go for the homogeneous part, so a lot of materials researchers and those who are in the field of materials or rock physics, they use this homogeneous part because this is having mass density, Young's modulus, and Poisson's ratio. So we are working for the grayscale part, so that we will be having our grayscale in our hand. So if you drag this for the positive side, so you will get all the things in the positive. That's why we are doing for the 0 or greater than 0 over here. If you want to edit your material, you can edit accordingly, because these are the equations that we are having in our hand for the coefficient of mass density, for the calibrations, and various Young's modulus and Poisson's ratio, where you have some automated equations already developed, and we have provided some inputs also, so that we can directly go for some visuals directly. Otherwise, if you have your input, then you can put your input right here. Your calculations is there, then you can just put your calculations over here. Your updated 3D will be ready according to your convenience. As I am having right now the number of steps only 5 here. If I'll be increasing my number of steps over here, then your accuracy, or the kind of we can say the accuracy in the part where you can see segment by segment very easily. So this is basically the grayscale part that we have covered. And just for the final one, I'll show you one thing, because it will take some time to perform in that. So I'm having right now the right femur is active. I'm having, if I'll go for the full model, then directly I'm having the volume mass generated over here. You can see we have fine and very much accurate mass generated. Similarly, if you want, we have some measurements option, as I discussed. If you go for the volume, if you just want the volume to be precise over here, then go for the primitive. This is over here. This is showing the total volume elements, right, in a particular area, which is our right femur. So if you go for the ellipsoid, just for the primitive, taking a primitive, if you just have this ellipsoid over here, this is let's say your area of interest, if you want to say. So see, and when you just go, just a second. Yeah, so you can see the volume of element previously were different, and right now where I've just kept my ellipsoid, these volume of element just changed. If I just go for some more, and just you can see the difference in volume of elements right now. And similarly, you can go for the volume fraction if you had different states of matter, or different element in your particular bone or something, or in your different model. So this is showing right now the volume fraction of element that we have selected right now over here is around 29 or 20%. Similarly, you can generate your surface area. Right now we just don't want, so if you want, then you can just go for the surface area. You can see, and we had the option mass density. This mass density is the option where you want to separate your or segment your view. Let's say I just want before that separation of view, I'll tell you one thing. If you want to access your full information in a particular file, then this is the report option right here, where you can go for the multi-level mask, because we have performed it here for the multi-level mask. So by taking this report, you can directly have in your hand your final report. And finally, you can just have the FE model or your particular design in your hand. Let's say I'm enabling this part. What it can do is, let's say somebody, some doctors want that we just want to segment our artery, or we just want to segment or see the artery inside, or the pelvis from inside. Then you can see from the inside that what we have basically done here. We have done our FE meshing, then we have segmented our slide. and you can see the elements over here, the tetrahedral, as well as we went for Fe free option. That's why here others also can be visible, and you can see the tetrahedral element as well. So when you rotate your view, then you can just go accordingly. Then what segment you want, how much segment you want, what is your basic requirement, and the area of interest. So, sir, finally, this is from my side, and I think for the time constraint, I just able to cover these things very in a pace manner, because we have very less time in our hand. So thank you so much from my side.
Yeah, Vijay, very nicely presented. I think you have covered some great innovative solutions that can be really useful for doctors. Dr. Abhijit, sir, anything that you have to ask?
Query to Dr. Vijay is that how much time it takes to learn for a new person like me to
Sir, it depends totally on your model, or your complexity, or your pace. Like how much you fast can you just go for
the
the
average
practice.
time means 10 days, 15 days, 1 month, just to get basic knowledge that we can develop our things.
Sir, basically, this is a learning of a tool. So if I'll show you some tools over here, like how to paint, how to threshold. If I'll be telling you for a single point of time that how to threshold your model, how to threshold from your micro CT or CT. So this is a one-time stuff, and within 10 days or 12 days, you can easily. Maybe your pace is fast, then you can learn fast as well.
This is available online tool, or how this can be made available to us?
Sir, basically, we just provide 30 days trial for just
free trial is there?
Yeah, that's not called free trial. We just provide a free trial for those who want to see the software capabilities in that particular time. If you want to purchase, or if you want to take that access for a long time, then you have to purchase with proper proper method, because we don't provide free access.
Okay, and the subscription is for 1 year, or what is that thing in future?
Sir, if you want to know for the subscription and all, we just get back to you via mail, where we can provide you all the details.
Definitely. Shibuji will just share your email ID and phone number so that we can be in touch with you.
Yes. Fine, sir.
So,
fine. We'll be happy.
So, Dr. Simpleware is also one of our technology members in 3D Graphy Consortium, because as I did mention, that earlier also I did mention that we are actually building this consortium where all the technologies are getting registered to come up with the solutions to be offered to the end users across specialization. So democratization of 3D technology is very required. So we have experts in the panel today. We have Simpleware. We also have Altair. A lot of solutions that they offer in simulation. So simulation is also very important. Dr. Jay, sir, you have any questions to ask? And how does it really help in your case also? Maybe I'm sure so there will be a lot of simulations required.
Yeah, that's right. So we use mimics to some extent. So Vijay, can you give us an idea about Simpleware comparison, including some idea about cost? You were asked about cost, but so after the 30-day trial, what is the cost implication?
Sir, for the 30 days, if you want the access from our side,
no, I want for the after 30 days. After 30 days.
Sir, this is a commercial software. So, if you don't mind, then can we discuss through contact or offline regarding the pricing and the pricing details?
Yeah, definitely. Send me a quote. I've gone through the 30-day, so there is some interest. It doesn't have all the functionality of mimics, but I see now that the version that you are now talking about maybe improved. So we may want to look at it again. So be in touch with me.
Yeah, fine, sir. We'll show you some more. Because of time constraint, we are just able to show some less things. So many things are also there where you can explore more. So fine,
Vijay,
sir.
Yeah, Vijay, all these, as I mentioned, that these 3D graphy news spotlight is also something that we do, where there is a series of information source that we translate through sessions like these. So we can actually also go in detail, as Dr. Sir also wanted to know more details. We will also have it for
Yeah,
all the institutes separately. So that time you can actually make a presentation widely to the institutes per se, in terms of how, because I'm sure you will also have this educational license, which is not a commercial license. Commercial license varies with.
yeah, kind of, sir. Yeah,
So
education. Yeah,
Sir
so
comes
many
with
institutes
his
are already
background. Yeah.
using.
Yes.
Yeah,
So for IIT Bombay, I think it will be educational. So I think the price point will be much lesser compared to a commercial license. So we will have a separate session also to have more details being shared with all the institutes also, and there you can also broadly explain what and how that can also be useful for the institute, because our tilt is towards the end users, ensuring that how the end
yeah,
users can get the best result out of it. Thank you so much,
yeah,
Vijay.
yeah,
And
yeah.
anybody else, sir, Dr. Narayan, sir, any thoughts that you have to share on the software, because
Well,
everything is internal construct.
I'm a clinician. I'm more
Right,
interested in delivering to the patient rather than learning the intricacies of all these things. So
right,
what I got
right,
from the information which Dr. Vijay has got, that he is providing a software in which we can assess the shape or the size or even the mass
right.
density of the area of the interest. So what we feel that now, instead of learning the software, okay, if we get some help, on case basis, what I will say, the case basis, you can charge for that upon case basis. Instead of buying the whole software, learning through that, Dr. Abhijit has said that how much is the learning curve and everything. So we clinicians will like to concentrate more on the surgical aspect, and then you can provide all these things there and provide the software, and the person who is using that software and will tell us what is as I told you, what is size, shape, and the mass density. And the material can be provided by the researchers like Dr. Jayesh. That will be helpful for the root orthopedic surgeons. We can use this particular technology. That's why I feel.
Yeah.
Instead
So
of learning these things and becoming specialization only of this thing, we like to
right,
remain
right.
as
Got
a
it, sir.
surgeon, and some specialist can give help us for all these things. So it will be
Very
going
true,
for a
sir.
large
So
population for this.
exactly, sir. So there are these service centers, sir, who actually buy the software, and they also act as a 3D consultant to
I'm sorry.
interested in. I get your
I
point.
think
Thank you so
whether,
much, sir.
yeah,
So,
right. Thank you.
anything that, yeah. Anybody else have any queries, or we move to the next speaker? Yeah. Thank you so much, Vijay. May I now invite Dr. Abhijit Salunke, who is a
Yeah.
orthopedic oncology
So I'm
oncosurgeon.
sharing my screen. So
Yeah.
is it visible?
No, because I think Dr. Jaimil
I need to.
deactivated.
Good
Okay.
evening, friends. So we'll start my presentation. So the topic is 3D printing in orthopedic oncology, and the work has been performed at Gujarat Cancer Research Institute, Ahmedabad. So this is the place where I work. It's a 750 bedded government cancer center. So it's one of the highest volume center across the country. So we use all modern gadgets and technologies which can help our patients. So starting from 3D printing, gamma knife, so multiple modern technologies are available. So what is 3D printing? So God created the world and all the things. So human thought that they also will do something similar to God, and this was done by the humans. So 3D printing is similar to this, like cocoon made by the insect. So you use a material, a printer, which will help to make a cocoon, and the cocoon is prepared. So this is how 3D printing works. You want to design a shape, implant or size or a plate that can be made. So these are the multiple aspects what we use in 3D printing. We are using a model. So this is a TBL model where the tumor is, where it starts, where it ends. You can show this to the patients. So for patient education, this can be used. This can be used for printing a metal plate. So this is a metal plate which was printed according to the size of the patient, similar to wrap plate. having few solid parts and few screws. In the upper part, there is 3D printed scapula, which was used. So 3D printed scapular model was used and 3D printed implant was used. On the below left side, we can see 3D printed foot with the tumor involving the calcaneum. So whole calcaneum is involved by the tumor and you plan your surgical cuts. And on the lower right side, we can see 3D printed talus. So these are the multiple aspects which can be made with the help of 3D printing. So we'll go by a few cases. So this is a case of 3D printed talus. The surgery was done by us at GCRI. So we prepared a 3D printed talus, a model, and this is the resected specimen. So this was the talus which was removed, and this is the 3D printed model. So this was the case, chondroblastoma of a right talus bone. This was the surgical incision which was planned. Patient in supine position. This is lateral position, and we marked the incision. So this was the planning images taken with IRTV. So we marked all the parts of talus, anterior part, posterior part, superior part, and the inferior part. So this is the inferior part of the talus. This was how the skin incision was marked. So laterally, lateral malleolus, medial malleolus, and this is the anteromedial incision which was taken. This is the medial malleolus. So skin incision was taken and the wound was retracted with the help of K-wires. So minimal handling of the flaps is done. So this was how the ankle movement was present. And this was the talus bone which was affected. So the surgical dissection, the talus was resected. This was chondroblastoma, so the talus tumor is removed. So this is whole talus which is resected. So talus is having attachment with the tibia and the calcaneum. So this is how the talus bone was resected. This is the 3D printed implant which will be placed. So it is having an anterior attachment with the anterior bones, superior attachment with the tibia. So this is the IRTV images of 3D printed talus. Here we can see continuous images. So this is how the ankle movement is occurring. This is IRTV images taken intraoperatively for this patient. This is the anterior view and this is the lateral view. So the implant was very stable. This was how the closure of skin and soft tissue was performed. So 3D printed talus is useful so that the patient can have ankle movement. This is a very good alternative for arthrodesis, in which you use to fuse the calcaneum with the tibia with the help of fibula. So 3D printed talus is good enough alternative. This can also be extrapolated in trauma cases like avascular necrosis of talus. So second case is case of scapular tumor. And this is the radiograph showing lesion in the left scapula of the patient. This was the CT scan. 3D CT scan was performed. Ewing sarcoma was the histopathological diagnosis. Patient was treated with neoadjuvant chemotherapy. So it responded very well. And this gave us time to manufacture the scapula. So this is the biopsy scar. Patient in supine lateral position. This is how the scapula is designed. So the superior part, anterior part, posterior part. So in this design, we can see the coracoid, but in the final design, we removed the coracoid because we didn't wanted it. So this is how the surgical incision is marked. Patient in lateral position, biopsy scar is included in the surgical incision. Here we can see acromioclavicular joint, lower part of scapula. This is how a 3D printed model was used so that we can get exact idea how the tumor is resected and how much part will be resected. So this is an intraoperative video showing how the tumor was resected with good margins. Whole tumor is covered with the soft tissue. So this is very important in malignant bone tumors. So this is the resected specimen. So size is around 22 centimeters by 15 centimeters. And this is the resected specimen and the model. So the implant is placed and we fix the implant to the adjacent tissue. This is the final implant which will be placed and it is having attachment with the humerus. So you can resect the humerus also But in this case, the humerus was good enough, so we didn't resect it. The acromioclavicular joint was reconstructed. We made multiple holes into the humerus so that a mesh is used to fix the humerus with glenoid. Acromioclavicular joint is fixed, and the scapula is covered with the latissimus dorsi flap. So this is the case of 3D printed scapula, which is very good alternative for treatment like we were previously doing no reconstruction. So just covering the humerus, fixing it with the clavicle. So with the help of mesh, that can be one treatment. Second, you can radiate the tumor bone and put it back again. And third is use of 3D printed scapula. So we think that this will be a better alternative to ECRT because the tumor radiated bone gets reabsorbed. After a few years, it is having no blood supply. So advantage of 3D printed scapula here, patient will have good amount of abduction around 30, 40, 50 degrees and forward flexion. So next case is of 3D printed model and a jig which was used. We are seeing two cases of implant. One is talus and second is scapula. So this was a case where we resected the diaphyseal tumor involving the femur. So in these cases, the hip joint and knee joint is preserved. The tumor is involving the diaphyseal part of the femur. So a small schematic video how the tumor is removed. So you preserve patient's own knee and hip joint, so the patient will have excellent function after surgery. So this is the resected specimen. We will dip it into liquid nitrogen, bring it back again. So this is liquid nitrogen at minus 180 degrees. Bring it back again, treat it for 20 minutes. Then thawing is done. So this is how this looks like ice cream stick. So thawing is done for 10 minutes to 20 minutes in normal saline and in air, followed by fixation with the help of a plate. So this is how plate is used. So this was a case of osteosarcoma involving the femur, and it responded very well to neoadjuvant chemotherapy. This was the MRI of the patient. So here we can appreciate the tumor is extending up to the fascial plate and it's just few centimeters away from the knee joint. So you have to plan your cuts very precise, and for precision you can have two methods. One is 3D printed jig. Second can be use of computer navigation, which is available at very less centers across the globe. So 3D printed model is very useful thing. So this is how we use 3D printed jig so that your distal cut is planned exactly and the proximal cut is planned precisely. It's just few centimeters away from the knee joint. So you preserve the knee joint and be away from the tumor. So planning with the key steps with a 3D model. So this is the front view and the back view, how this cuts will be taken for this patient. So intraoperatively you are using the jig, plan your cuts. So fix the jig to the tumor bone, normal bone with the help of key wires. Be away from the tumor. Take your cuts. So this is how the distal cut will be taken. And this is the bone cutting saw which will be used. So here we can appreciate very small amount of bone, knee bone, distal femur part is preserved. And this is the inked part. So this is how liquid nitrogen is poured. It is at minus 180 degrees. It is treated for 20 minutes. And the tumor bone is thawed. And we used here plates. So next case is of an expandable or a growing megaprosthesis. So these are used for pediatric patients. So this is how the expanding mechanism is prepared. And this implant is prepared with the help of 3D model and patient specific customized implant is prepared. Case of Ewing sarcoma, this is the resected specimen, tumor is removed and this is the implant which is used. So this is size matched exactly according to the patient. And this is how expansion is performed for these patients. And we use gastrocnemius flap to cover this implant. So next is a case of 3D printed calcaneum model. So this is how the 3D printed model of calcaneum is used. This is the 3D printed model of foot. This was the incision. Vessels were isolated, and this is how the tumor is resected, and we can plan how much the cut was: anterior cut, superior cut, and the posterior cut. So this was the resected upper part, lower part, and the posterior part. So this was a malignant bone tumor involving the calcaneum. And in this case, this was a resected specimen, and free fibula was used. This was the closure for this patient. So this is the last case involving the tibia. 3D printed plate was prepared. This was the skin incision. The tumor was resected. This is how the neurovascular bundles are saved. And fixation done with the help of a plate, distal osteotomy, proximal osteotomy, and liquid nitrogen again used. This is the liquid nitrogen treated tumor autograft. Plate is used. So you can use a precise, perfect plate with the help of 3D printing. Distal cut and proximal cuts. Thank you very much. So if you have any queries, just can email me the queries.
Dr. Abhijit, can I ask you one question?
Yes, sir. Yes, sir.
Yeah. What are the material used when you are using the implant by
Yes,
3D
sir.
printing? What are the
Sir,
material
this
you
was
use?
titanium implants. Titanium was used.
Especially in weight-bearing areas.
Yes, sir.
But scapula
Titanium was
used
used.
for what? For weight-bearing also you are using titanium.
Yes, sir. We are using titanium. So talus is a
Okay.
weight-bearing bone, and
Acha.
titanium was used.
Okay.
For
So
plates, we are
what is the
using
longevity? What is the
titanium.
survival rate? What is survival rate for that?
Survival rate
Especially
is good,
in
sir.
weight-bearing joints. Yeah.
Yes, sir. It is good, sir. It is good, sir.
Wow. Yeah. Because really revolutionary from the life-saving to the
Yes, sir.
limb-saving and to
So
the
this was
reconstruction.
these are two cases where in talus we did 3D printed talus, and
Yeah.
scapula also, sir. We have done two cases. So it is good and useful method, sir.
What I exactly got it from this that we can use the 3D technology not only for using the replacing the part of the bone, but for
Yes, sir.
using the implant also when you want to put allograft, liquid nitrogen treated allograft, that you can use the implant also by using the 3D technology. What exactly kind of implant we can use there? That is a really thrilling one.
Yes, sir.
Yeah. So
Yeah,
congrats for
this is
that.
Jayesh
You are
here. Can
doing
I?
really
Yes, sir. Yes, sir.
extensive
You can
work.
ask,
Yeah.
sir.
Yeah, very, very nice work.
Thank you,
Great to
sir.
see. Dr. Salunkhe, can you elaborate on the, I saw that you had maybe it was titanium nitride coated or something, but is there
Yes,
any
sir.
any frictional issues that you will see over a
Sir, in
period of
next
time?
stage, we are planning to use a poly material over the titanium material. So that is the plan. So this was the first case. So in this case, it was just initial phase of our thinking of 3D printed talus. So in the second case, we have used poly over the talus, and in the tibial part, it is metal. So it's metal, poly, metal. That type of we have used. And in scapula
Okay.
also, the inner part was of poly. So humerus normal bone, a poly material or a titanium material. So that
So
is used.
the polymer was coated on, or was it like a meniscus film?
So it's just placed over the talus, sir. So it is mobile, sir, not fixed.
Okay,
See,
right. So
what I
it's
put
more
one
like,
comment here, what I put
yeah,
one comment, Dr. Jayesh, is
Yes,
there
sir.
are two different issues. One is the one which is which is non-articular area or extra-articular
right.
area, where the titanium is very much useful in the extra-articular area, where there is no movement at all at that place, like say the scapula or the shaft of the
Yeah.
femur. But when it comes across the joint, the intra-articular area, that's what Dr. Abhijit has said, that the polymer, especially the great polymers are available these days, which can last for longer time, and there are many varieties of that can be cemented or even the non-cement also on the titanium base, and there they can provide the movement at that side, though not exactly the normal movement, but the lot of a better range of movement it can get across. So there the polymer used, and for the other extra-articular area the titanium is used. That's what I
Yeah.
got from
So
the discussion.
Yes,
yeah.
sir.
So these polymers, do you prefer them cemented or uncemented?
So this was uncemented, sir.
Okay. And what
In
is
this case, it will.
so typically these would be ultra molecular weight polyethylene
Yes, sir. Yes.
spacers, right? So is there some wear issue associated with them
Yes,
that
sir,
you
there is
have
wear
noticed?
issue. Yes, sir, there is wear issue. So, in this the mega prosthesis case, which I showed of the pediatric patient,
Yeah.
expandable joint.
Yeah.
In
Yeah.
that case, we have issue of polywear because they are hinge joint. It's a hinge joint. So, alternative is a rotating hinge, but they are very costly. So, the hinge joint
Right.
is in pediatric patient also is costly. So, they have wear after 2 to 3 years or 4 years. So, we have to change the poly. In nearly all cases, polywear is a major issue.
So
So we need to find
you
some
need to change it
solution for
after
that.
what, 2 3 years? 2 3 years you have to change it
Yes,
every 2 3 years.
yes, sir. 3 4 years we have to change it.
Three
The
four
Indian
years.
joint,
Okay.
the foreign implant it lasts longer, but the cost is very high.
Right.
So the Indian implant simple mega process costing around 1 to 1.5 lakhs. The foreign
Right.
implant is
Right.
costing 6 lakh rupees, four
Right.
times more than this, and they are rotating
So
hinge. R
yeah.
is fixed hinge. That is one difference.
Right, right. Yeah, so like Dr. Karne says, would cementing, reduce some of these issues?
So difficult to say because these are the hinge joint and the part of poly is at the hinge area. So it is
Okay.
bound to wear. So rotating hinge is one bit better solution that lasts for 10 to 15 years.
What
Ours
about
is a simple.
in the Talus example that you gave?
Yes,
What
sir.
is the wear? You have noticed good wear? I mean, some extended wear?
I'd say the case was done a year back. A year back. So we need
Okay.
a long-term
You are
follow-up of
still
these cases.
observing. Okay, okay.
Still we
But
need.
great.
But
Yeah,
in knee joint,
great work.
it is wear is definitely at 3 4 years. We are having facing that problem.
Very good. Great work.
What
Yeah,
I,
happy to help
yeah,
in
yeah,
some way with
Thank you.
biomaterials. Thank you. Thank you.
We'll be
exactly.
Thanks
happy
to
to
you and Dr.
get
Karne.
solution that will
At
be
present,
decrease the wear rate. So.
Yeah.
At present, till we get a good biomaterial, which we expect from Dr. Jayesh, we have to use these synthetic materials or the artificial materials. And all artificial material have got some life. It
Yeah.
depends upon how you are using it, what is the weight of the patient, and all those things are important. But it is
Sure.
it is an interval surgery. What I put as an interval surgery, which
Yeah.
needs to be like our all tire or our sleepers. You have to change it over a period of time. But then as we are waiting for an orthopedic surgeon, we are waiting for the biocompatible material which can last for a longer time, or even a biological material rather than
Right.
biocompatible. I use
Right.
the word the
Right.
biological material. If you
Sure.
get that, then it will really revolution. Till then, we have to use all these material which are biocompatible, but they are synthetic materials.
Yeah.
So the liquid nitrogen case, the bone gets reabsorbed, means it gets normalized in 1 to 2 years time. So that is good
Okay.
enough method. So for diaphyseal tumor, it's very good. Liquid nitrogen or
Yeah,
ECAD treated
yeah.
bone. But for joint, we
Lovely.
don't have
Lovely.
that.
Great work. Yeah. Yeah. Great work. Thank you. Thank you very much
It
for
is, it is a
taking the
biological
work.
scaffold which is Dr. Abhijit is providing with
Yes,
the
sir.
liquid nitrogen.
Yeah. Yeah.
But
Yeah.
your scaffold, will be thrilling to use that your bioabsorbable scaffold, which can be replaced by the natural tissue. And here in allograft, it is a biological scaffold, which is neutralized by using the liquid nitrogen. I mean, the excessive, those malignant tissues which have got a very high proliferation rate, they are
Right.
affected more than the normal tissues. But then that needs to be absorbed. Where if it is a long, the tissue which is a long tissue, then it take very long time, and
Sure.
probably as a clinician we feel that it may not be replaced completely, but then it is still best hope at this time.
Yeah. Yeah. Naturally. You're doing great stuff here, all of you. Thank you. Thank you so much. Look
Thank you, sir.
forward to helping you in the future. Bye now.
Thank you, sir.
Thank you, excellent work.
Okay, Narayan,
Thank
sir.
you. Yeah.
Great, Dr. Abhijit. Thank you so much for this beautiful presentation and a very detailed one. Mostly, there are so many applications that you've been working. Every time that you have a presentation, Dr. Abhijit, it's
Yeah.
something which is a new one in terms of a very
So we
innovative way.
did the newer cases scapula and talus. So that was a
Yes,
newer thing that we
yes,
did.
yes, yes. I know that Dr. Vikas and you both were working on it.
Yes, so
Dr.
that case was done together with Vikas
Exactly,
and
exactly.
with that.
Fantastic, sir. Fantastic. Good work, sir. Thank you. And
Thank you,
it was a great presentation.
thank you, sir.
And now let me introduce you all to Dr. Claudio Soto. He's the Chief Medical Officer and also the founder of a very unique material that they've been able to manufacture. It is they are into antimicrobial materials, and the company name is Copper 3D, and he's joined from Chile. Good morning, Claudio, and please now you can share the presentation. Yeah, thank you.
Thank you for the intro, Dr. Chiwu John, and awesome work. The presentation before me, it's very, very impressive. Let me introduce myself a little bit. I'm physical medicine and rehab doctor. I'm not an orthosurgeon, but I'm working on antimicrobial materials and moving from antimicrobial materials, addressing some solutions for orthopedic surgery, mainly surgical guides, but maybe we would we find some point of collaboration in this field. I'm starting my presentation. This is an antimicrobial 3D printing. Copper 3D is a company with global presence specialized in copper-based antimicrobial 3D printing. We started this sector in this industry, and we developed the first portfolio, okay, with antimicrobial materials. We have international validations using ISO standards. We won 2 NASA grants to develop medical devices. We were, as a Copper 3D and as a team, awarded as a Material Company of the Year two years in a row. And we were selected as one of the top 5 most relevant companies in additive manufacturing worldwide. And by the way, we are FDA and EPA registered company. And our purpose here is we hack material to save lives. And our value proposal is the ability to transform a regular material into an antimicrobial material capable of consistently and continuously eliminate microorganisms in all kinds of 3D printed objects and solutions. For example, on the right, you can see antimicrobial isols for address diabetic food. Our material capable to kill germs quickly, such as Escherichia coli, Enterococcus, Salmonella, Pseudomonas, Staphylococcus aureus. We, as I said, have a lot of international validations here in Chile, in Chicago, in the US, in the UK, in Middle East, in Dubai. And our resin are capable to kill germs as well, and kill not just bacteria, virus, and fungus. And virus, for example, we are capable to diminish the viral replication of HIV-1 up to 58% in 50 seconds. And we are working on that in a device capable to kill more than 90% reduction of this viral replication. Kills human coronavirus, our material. We tested in the Institut Pasteur in France. And our portfolio, our antimicrobial material is biocompatible as well. We tested the biocompatibility using ISO 10993 in 2 different labs in India. And we are EPA and FDA company registered. And we started in 2016, and now in 2022, we are trying to find point of collaboration in the Indian industry and in the Indian healthcare facilities. That's the reason because I'm here. Solutions, for example, we have a material for FDM, Peleactive or MDFlex is our flexible material, capable to produce some products, ortheses and prostheses. But this is our key material, resins for SLA 3D printer. And we are producing here in Chile a specific device for a specific anatomy, specific surgical guides for lesions and orthopedic surgeries, in this case in shoulder orthopedic surgery. For example, you can see the resin on the top of on the left on this screen. and the device, the design, using a SLA 3D printer, and finally enter in the operating room to use this surgical guide to better position the prosthesis. We have now 13 surgeries, and Graphy map, we are address and get shorter surgical times, huge precisions in prosthesis positioning with a deviation less 1 degree, and optimal surgical and functional outcomes. So some other applications, orthosis, but in maxillofacial surgeries, or PSI, surgical guides, osteotomy guides, pins, spacers, separators, or customized projects. For example, I'm sorry, I'm not an orthopedic surgeon, but maybe we can find some point of collaboration, developing surgical guide, osteotomy guides, or, as I said, personalized projects. We are so eager to start to collaborate with different facilities in healthcare in India. Finally, applications of antimicrobial 3D printing. Our material is biocompatible. We can develop personal devices addressing the high precision surgeries. Our materials are antimicrobials with high precision results, shorter surgical time, and less cost, at least in Chile, than other solutions. 1/3 of the total cost. Thank you so much, and we invite you to collaborate with our company. And thank you so much for the invitation, Dr. Chibujon.
Thank you, Dr. Claudio, for your presentation. Dr. Narayan sir, any thoughts that you have on the subject, on the materials? Any questions? Also for the panel, it's open. Thank you.
Well, thanks, Dr. Claudio. You have given an excellent input from, such a long distance, exactly opposite side of the world of that of India, and we are very happy to hear you that. You have given an excellent solution for the orthopedic surgery, because the great things in the patient minds of the orthopedic surgeon, the first thing is the infection, apart from the rejection. And if you are providing this particular material, which is which is act as an antibiotic, antimicrobial material, I just want to know how long this activity, antimicrobial activity, lasts, because it must have some life, half-life or a life. How much is that?
Okay, it's a good question. We are tested using some specific tests in the US, and our material at least works at least in a year. Okay, but we know maybe it's longer than a year, but we have this type of tests. I don't know if you are you following me, doctor?
Yeah. But then what after 1 year, when that activity goes off? Because these are the materials which are supposed to last longer, we can say for decades in the patient's body. So what is the situation after 1 year?
Okay, we are if I understand, we are not working in an implant device here in Chile. We are using surgical guides. It's used to position some type of prosthesis, but we are not working in implant device right now. We are addressing the surgical guides mostly. Okay, but our materials are for FDM technology, using biopolymers plus this additive based on copper with antimicrobial properties, and the other one is resins, biocompatible as well, but not thinking in implant device right now. We have some prototypes using antimicrobial titanium, but it's in a very, very early stage.
Okay, that's fine. So, and then I just simple question from any patient or orthopedic surgeon is, what is the cost and availability in India?
Oh, cost. Yeah, we are talking about it with Dr. Chibu. We, in terms of the materials, for FDM, more or less $30, more or less. But we are not discuss deeply. But we need to, as a chief medical officer, understand more deeply. Sorry, the market. But I don't know. Sorry,
Okay. No problem. Fine. Thank you very much.
I'm a doctor.
Yeah.
But you're right. Yeah, it's important topic. It's important issue.
Yeah. Thank you.
Yeah. Thank you, Dr. Narayan, sir, and also Dr. Claudio for sharing your information. I also have Ketan Jajal, who is actually a company offering 3D printing services. So maybe he would be more interested to know about your materials because he offers services to the orthopedic surgeons. So, Doctor, this is something that we were discussing earlier, Dr. Narayan, sir, that Ketan comes with his expertise in terms of offering solutions. So Ketan, we were discussing on this in your earlier sessions that if the software sessions, as in when it comes to any solution on software or now even material, you would be the right company to offer solutions. So how does it work? One is your first question to Dr. Claudio, and then probably the earlier question that probably I would want your inputs on. Ketan, are you there?
Yeah, could you repeat me, please? Here is a little bit
Yeah,
noisy.
Ketan, we are
Sorry.
not able to hear you. Ketan is from the audience, so I just invited him on the stage. So, Ketan, you had a query? Ketan, are you with me?
Yeah. Could you repeat me, please? Here, it's a very.
No. The question was for Ketan Jajal. He had a query.
Okay.
He's just
I'm sorry.
so he's put a question on the desk. He said, "Do you have FDM material that is medical grade?" Okay. So that's the question from Ketan.
Okay. Yeah.
In the discuss panel, yeah, he's posted a question. Yeah.
Yeah, it's a medical grade. As I said, I can share the certifications. We tested the biocompatibility in India in 2 different labs. Our materials and our some customer in Brazil develop the certification in totally different countries. Works perfectly well, and we have another paper developed in Italia that they tested the material in cells cultures, and the result shows it's not cytotoxic. So that is the whole certifications and scientific validation that we already have.
But it is not approved for implant grade, right? It is not an
No.
implant grade.
Hello? Can you hear me?
Not for implant.
Can you hear
So
me?
it is
Hello?
only for external use or limited contact. Okay.
Yeah.
Hello?
Exactly.
Am I audible?
Hello. Yep.
Yeah.
Can you hear?
Ketan,
Hi,
please.
this is Ketan. Can you hear me now?
Yeah, Ketan, please.
Okay. Sorry about that. I had some technical issues. Yeah. No, great presentation, Dr. Soto. The question I had, I think you already answered, but so the FDM material that you have is biocompatible. Is that correct? Okay. And, the other question I had
Correct.
was, usually one of the challenges that we face, because we feel that the combination of FDM technology and biocompatibility on the filament really opens up the door for innovation and accessibility for many surgeons, at least in India, what we have seen. Because, the machines are not that expensive. And, once we have the design, which is what we do, the access to these technology becomes much easier. So it's great to hear that there is a company that is doing a medical grade FDM filaments that can be used. The other challenge that we see is around sterilization. So while FDM can be used, the sterilization method, we have to do like an ETO, but there's the preference generally is around using the steam sterilization, which is at a higher temperature. So I don't know if the materials that you have can withstand steam sterilization temperatures like 130, 140 degrees centigrades.
Yeah, good question. Regarding the sterilization, the resin that we are producing, we are using I can remember hydroxy peroxide of hydrogen. The name of this type of sterilization is Esteran. It's a gas. Okay.
Sterile. Yeah.
And works perfectly well. The material doesn't suffer deviation or stuff like that. Yeah, and the FDM material, we of course we recommend not use heat, sweat heat or dry heat for sterilize the device. So other techniques works for concerning our material.
I see. Okay, but ETO it works, is it?
Yeah,
it works with the ETO. Okay,
works,
fantastic.
works.
Awesome, great. And Shibujan, what was the question you had that you want me to comment on? I'm sorry.
Ketan, Dr. Narayan sir had one question is that one is we have one software company in the panel. They made a presentation, and so now this is a simulation software by Simpleware. Right?
Yes.
So are you using a Simpleware software currently?
Yes, we do. Yeah. So we have both Materializes Mimics as well as Simpleware. So we have both of them FDA cleared softwares that we use. Yeah.
Okay. So for certain doctors, maybe they don't need to buy the software. They would probably look at these case-to-case basis where they need those solutions.
Correct.
So you would be able to offer that solutions to
That's
them,
right. Yeah. So that's the whole premise of how we started Jajal Medical, because we realized that one is surgeons don't have time to do segmentation and design, right? They want some help. So somebody else can take care of the biomedical engineering team can take care of this. So our goal is, that's where we created this online platform. So if you go to jajalmedical.com, there is a upload button where you can upload the DICOM files, and in the back end we have multiple licenses of Materialized Mimics and Simpleware in our team of segmentation and design engineers who would prepare the initial plan and say, okay, because we are also realizing that as we do more cases, we are also able to understand what would be a typical step that would be followed in terms of whether it would be a guide or a model or an implant, and then we do an initial surgical plan and share that with the surgeon, and then based on that the surgeon kind of defines and decides what to do. So that way the capital investment is almost zero, right? The surgeons and the hospitals can immediately kind of get going with it. And we have had situations where over a period of time the hospital would say, okay, I think we have enough now, we are going to set it up in-house, and we have supported them saying, okay, maybe for 6 months we'll have our engineer there and help you kind of walk you through while you kind of take and run on your own. So we've kind of taken the end-to-end spectrum along with it.
Okay. Thank you so much, Ketan. Dr. Narayan sir, hope that query was also answered.
Yeah, that query was answered well.
Can I ask one question?
Yeah, please.
Only thing is one when you're putting the material inside, okay, whether after sterilization, I don't think any antimicrobial material will last the steam sterilization. You have to go for either ETO or MAX, the chemical sterilization. Heat sterilization will not, steam sterilization, it will be dry or the steam sterilization. It won't, the antimicrobial material will not last with that. The second thing about we can say the material which you are putting inside. If you are using as an implant which stays there for a long time, forever in life, it's something different. If you are using for some short time, if it has got some osteoinductive or conductive property, which will help the natural tissues to go over that, as what Dr. Jayesh is developing, that will be the actual dream of orthopedic surgeon. Let the right implant go out and the natural material take over. Till then, all this will be the interval implants. That's what, as a clinician, I feel so.
Right.
Yeah, let me add to what you said, Sir Dr. Narayan. So for even for customized surgical guides and all, we do have a steam sterilizable material that we use using the SLS technology. So with SLS technology, it's a polyamide nylon that allows you to manufacture these cutting guides and models that are a little bit flexible, but also steam sterilizable. So we have surgeon groups who are very passionate about using just that, as well as the SLA technology that even Dr. Soto mentioned. Those two technologies do allow you to do steam sterilization. And to answer your other question on the osseointegration, definitely that is absolutely, we believe, also is a future, and it's something that me and Dr. Abhijit also constantly talk about it, and we also believe that that's an area we're equally passionate about developing further, because at the end it is these structures where the osseointegration happens, where it is, and we're looking at both the polymer based as well as titanium based, because both of them hold a promise to us.
Thank you so much, Ketan, and thank you, Dr. Narayan sir, and also Dr. Claudio for a very a detailed presentation on the
Jaimin is having a
material.
question.
And
Jaimin is having a question.
please.
So, Ketan, if you want to share our DICOM files, then you can directly do it from your website only?
That's correct. Yeah, you just zip the DICOM files and upload the DICOM files and mention what is the anatomy, and then within 24 hours you will receive a link with a 3D model of that patient, where you can directly on 3D you can mention your resections, you can add your comments on initial designs, and then there is also a built in a video call conference in that 3D viewer itself, where it's all cloud based, and you can just say I want to talk to an engineer, and our engineer will come online and you can discuss about what the plan is.
So if we want to have a provisional plan, so is that chargeable, or we can just
No,
discuss it out? And
it's nothing is charged. We don't charge initially. We understand that many a times
yes,
patients also are so our conversion ratio, if you look right, out of 100 cases we have like about 60 that actually gets converted. 40%, we also, just like, I mean, you guys are also working hard to make this happen for your patients, right? So we don't charge for initial plan. Yeah,
yes,
if you decide that you want to have a 3D printed model or a guide or
yes,
an implant, we have
and that's
our
fine.
pricings. Even pricing is online for us. We
That's
kept
fine. That's
everything.
fine. But for initial plan, we
Yeah,
can
we
just
don't
discuss
charge.
it out, and
Yes,
then
yes,
we can.
absolutely.
That's great. That's
Yeah.
fine.
Hey Ketan, this is Jayesh here. I have a question for you. So we are looking at cardiac defects as well. Yeah. So is that something you can help us with, segmentation of particular parts of the heart?
Absolutely. In recently, we one of a very good friend, Dr. Mahesh Kappanelli from Amrita, is
Yeah.
helping us kind of build that competency. So now we have a dedicated team that does soft tissue segmentation, just soft tissue segmentation, because we realize that it's a very different skill, right? The
Right.
ortho guys like me don't understand, the mitral valve and the aorta and all the walls and everything. So we have built that competency now, and yeah, we've done cases in Chennai and even in Singapore, where we have provided a 3D printed heart model with some initial designs and things like that.
Okay, great. So maybe we need to talk here. So just be in touch with
Sure.
me.
Yeah.
I'll try to
Absolutely.
find
Yeah.
your email and be in touch.
Sure.
Thank you.
Yeah. Thank you.
Great. Thank you so much, gentlemen, and for our last presenter also for sharing your insightful presentation on the subject on materials. Now we will dwell upon and also have Mr. Sushil Mane, who will actually share his presentation on the software part, the simulation part again.
And you can hear me?
Yeah,
Yep.
you can see
Yep.
your screen. Yeah, thank you, sir.
Okay, great. Thank you. A very good afternoon to everyone on the panel. We have very esteemed, let's say, set of panelists over here. Dr. Jayesh Bellari, Dr. Narayan Karni, Dr. Abhijit Salunke, Dr. Jaymin Shah, Dr. Claudio, Mr. Vijay, as well as Dr. Ketan Jajal that I just heard him talk. A very good afternoon to you, as well as all the other people in the audience. Uh, as the panelists were discussing, it's all about how we can look at providing a solution to the patient, right? Who is actually waiting for a solution as far as his issue is concerned, the medical issue. And I've also heard about in the previous panel discussion, there was a talk about how product validation is really a key thing, and how we can minimize the overall time as far as product validation is concerned before you eventually go ahead and manufacture these 3D printed parts, right? And that is where we at Altair come into the picture. Altair is a product design and consulting company. We are close to around 35 years old, based out of US, and we have presence across multiple geographies. And as you see here, this is a quick introduction about Altair. The 21 revenues of around 532 million. We are close to around 3,300 engineers, scientists, as well as creative thinkers. 60,000 plus users coming from 11,000 customers globally. We have around 81 offices in 25 countries, and close to around 100 plus software products. The essence of Altair is to provide a simulation-centric portfolio to help address the design, data analytics, and cloud or AI solution to the customers. Our solution portfolio broadly can be classified into these six main buckets. So here, the key solutions as far as actually designing and developing these mechanical or electromechanical systems are concerned, we need to actually build a design, right? So the CAD is the initial point. Once a CAD is created, we go ahead and model that particular system. So in this case, it could be medical implant as well. So these tools help us to do all the finite element meshing of these complex structures, and then we go ahead and evaluate the performance of that particular product, for which you need to do various types of physics simulations, whether it is mechanism simulation of the whole human body, or maybe trying to really understand how is that particular implant which is fixed into the human body is behaving, depending on all the different, let's say, forces that the component is undergoing through. And how you need to really design these implants based on a patient specific requirement, how you can actually take the initial requirements from the customer and then go about designing and developing that particular implant. That is very important, and these physics simulation tools that Altair provides basically addresses this particular requirement. Of course, there are many other solutions from Altair, but I will not delve into it in detail. Those are in data analytics, Internet of Things, high performance computing, as well as we are also partnered with multiple third party companies as well, who provide the software with the same license that Altair shares with the customer. So the essence of my presentation was all about how we can accelerate this simulation-driven design, right? So the requirement here is to really look at how we can validate a certain design, an implant which goes into the human body, for which we need to create a very optimized design, which will help us to get to this patient-specific requirement, and then look at what are the different, let's say, loads and boundary conditions which have to be modeled, and how the particular component is going to behave, right? So for which we have a platform called as Altair Inspire, which accelerates this creation of the design. We call it a generative design or a topology optimization that we start doing based on the initial packaging space that is given by the doctor. And based on this package space, once we define all the loads and boundary conditions, we eventually get a very optimized design which can be 3D printable. So, so that's the first part of the solution. And then we need to validate this particular design. So once we have a 3D printable design which comes out of this optimization solution, we need to simulate all the different, let's say, loads and boundary conditions. So we need to do all the structural analysis, look at the dynamics of the whole motion, right? And this has to be done at a very fast pace, right? So this particular tool that which has been integrated into Altair Inspire, it's called as SimSolid, is a meshless analysis tool. Of course, the background of this particular tool is based on finite element analysis, but it does not have to be meshed, the component. So it has a very special analysis tool, and it is very usable in the sense that any user who starts using this particular tool will probably need 1 or 2 hours of training. So it's a very special solution that you get from SimSolid. And eventually, once you validate that particular design, we need to check for the manufacturing feasibility, right? So in this integrated solution, you can check for the feasibility of manufacture for 3D printed parts, right? So you have designed it, you have optimized the design, you have validated the design, and now you can go ahead and check for the feasibility of manufacturing. So all these different, let's say, segments or parts of the whole process of design and development are part of a single integrated framework, and that's called as an Altair Inspire. Um, the different manufacturing simulation tools which are integrated into Altair Inspire are shown here in this slide. We also can do a lot of casting simulation, metal forming, extrusion, as well as injection molding simulation, plastic injection molding, apart from the additive manufacturing, which is the 3D printing simulation. So, with this integrated environment, a designer can not only design and validate the whole design, but even you can check for the feasibility of manufacturing. With that introduction about the different products, what I would like to say now is that what would be the typical benefit that a designer or the end customer is going to accrue from this whole process of doing design validation. The first key benefit is that you can optimize the entire product performance, right? So, given the requirements of a particular component, a medical device, how you can actually simulate in this computer environment, uh, given the different physics that has to be modeled and simulated, can be quickly done in this integrated framework. Looking at the entire human anatomy, the physiology, the device design, and all those aspects related to the medical device. So that's benefit number one. The second benefit, as far as doing computer simulations and running these very complex simulations in this environment, is that it helps you to perform investigations where experimentation does not exist, right? Or is this very costly? So, to really experiment the performance of a particular design, it would probably take a lot of time as well as it is very costly. And of course, in the case of medical devices, especially in the case of implants, sometimes it could be unethical if you are trying multiple designs on a patient, right? You have to be really sure that the final design that you have achieved is going to be a perfect fit for that patient, right? So, having to do all those simulations in a computer environment and making sure that it is perfectly going to address the customer requirement is very important. And only then you can go ahead and manufacture and then implant that. The third benefit is the reliability of the design, right? So there are various requirements as far as structural strength or durability, the system motion, right, and the human-machine interaction, right. So as far as, let's say, in the case of some of these mechanisms, um, exoskeleton kind of mechanisms which help a patient to walk properly in the whole process of his motion or mobility assessment can be done in these kinds of simulations. So, a very reliable design is what you can achieve from these simulations. So, with that background, I would like to now cover some case studies on how Altair products, along with some of our partners in the manufacturing industry as well as in the medical industry, we were able to provide very good solutions. So those solutions or those case studies, I have put them into various, let's say, case studies over here. One is with regards to medical devices. The second one is on the prosthetics and orthotics, and some case studies on the replacement structures as well as implants, especially on reabsorbable biomaterials. And then some case study on the simulation of complex physics within the human body, right? So what I will do is I'll start with this case study over here. So, as you all know, these medical devices have to be designed to withstand all the structural or operational requirements, right? Not only for the normal use, but a lot of drop or misuse cases. In many a case, these medical devices are handled by, let's say, old people and who don't know how to use the product, right? And there could be a misuse case that have to be tested as far as the device is concerned. So how you can design and validate all these different cases within the simulation environment and make sure that the final design is optimized as well as high performance. Such kind of simulations, you basically can run uh, solutions in the form of structural analysis, thermal analysis, as well as CFD and electromagnetics. This case study that I will be talking about is about a self-injector, wherein, let's say, you typically use it for, let's say, diabetic patients, and you need to self-inject the liquid, right? So this device is very complex, and it is having a lot of different complex systems inside. There are actuators and sensors. There are, of course, batteries, for which you need to look at a complete system analysis, right? So within the simulation environment at Altair, you can not only model the actuators and sensors and see the overall performance of the system, but look at the specific mechanism simulation which drives the liquid into the human body. So there is a lot of mechanism analysis that one has to do. And then you also need to validate the design as far as drop test as well as misuse condition is concerned, right? And eventually, if you look at this device, the outer casing is made up of a very complex reinforced plastic, right? So this plastic has to be manufactured, and for which you need to run a lot of simulation, the injection molding simulation. So with the platform that Altair provides, the engineer can do all these complex simulations and then validate that design. Um, Here's another case study of a patient mobility system where Altair worked with Sarcos. Sarcos is a company which designs and develops a very complex exoskeleton for various kinds of use cases, not just, let's say, medical use cases, but even industrial use cases. And here, as you see in this video, we are trying to showcase what are the various aspects of design and development that you have to do in the simulation software. It involves a lot of motion analysis, trying to understand what are the typical motions that the patient is going to undertake. And based on these motions, there are a lot of these forces which are generated, right? So you need to really understand these forces, these dynamic forces, and then design each and every element of that exoskeleton, right? So such kind of simulations are very much possible, and even before you manufacture these exoskeletons, it is good to understand the human-machine interface. Uh, a couple of case studies in the prosthetics and orthotics. Here is a typical example of a particular orthotic implant where Altair worked with Andiomo in United Kingdom to improve the children's mobility by doing a lot of simulation and 3D printing. So this was a 3D printable device over here. A couple of other case studies before I end my presentation. This one is an orthopedic design which was for a stem implant, wherein Altair worked with a customer to get the complete requirements of this particular implant, the 3D model of it, then trying to design and develop this particular implant, a 3D printable implant, by using a lattice structure. As you see here, this is a lattice structure, and the particular requirement that it was addressing is to make sure that it addresses even bone growth when it is implanted, right? So it is a reabsorbable biomaterial as well. So by running all these complex simulations within Altair Inspire, we really could understand what is the stresses that a particular femur undergoes for all their different motion analysis that a patient goes through. And then trying to design and develop a particular implant, right? So here, as you see, once the implant is designed, you're trying to see whether the stresses are almost equal to a healthy femur, right? And in this case, it is slightly better, right? So the hot spots that you see here, the red spots are basically indicating high stresses. And the whole idea is to make sure that these do not cross the allowable limits, right? Eventually, this was 3D printed with lattice structures, as you see here, and you can even run simulations with these complex lattice structures to understand what are the stresses within the lattice structure, right? Here is another case study of a spinal implant, just to show the entire process. What we really do is define a package space wherein you need to design this component, and then you define all your design constraints to this structure and enforce all the loads and boundary conditions. And when an engineer runs this particular design for optimization, he gets a lot of different ideas. One such idea is this topological result, and then a 3D printable lattice structure as well. So eventually, the whole idea is to get an optimized high performance design, which is what such simulation softwares help you to achieve. So with that, this is probably the last case study that I would like to end with. As I mentioned earlier, this tool, SimSolid, is a very powerful tool as far as medical industry is concerned. One key reason is because, as you know, these medical structures are very complex, right? And the whole CAD model is coming from 3D measurements that you take, right? If you look at this particular picture here, it is a very complex structure. In a traditional process, if an engineer has to model and simulate in the finite element world, it would take a very long time because you need to mesh this complex structure, and running a simulation on a finite element model would take a lot of time. But that is addressed very well with this tool called as SimSolid, which is a meshless software, and it is very accurate, right? So in this particular case study, the customer here is Dr. Luis Ferreira, who actually worked with us on this case study. He's coming from the Schlisch School of Medicine and Dentistry in Western Ontario. And we were able to model all these complex structures of a human body and run the simulations and understand the various scenarios that it might really have a discomfort for the human body. So with this, I end my presentation. Thanks so much for giving me this opportunity to present Altair's technology, which is on simulation, and look forward to a lot of collaboration with the medical industry for the betterment of the human life. Thanks so much.
Can I ask the question?
Sure, sir.
Yes, yes. You said that you can do even simulation on this model without making a mesh model and having a multiple nodes.
Yes, sir. Correct.
But how the calculation of the muscle forces and different things, you cannot have different forces acting in the x y z axis and resultant force you cannot calculate, and you cannot calculate whether which force will come more, where your implant requires enforcement and where it doesn't require enforcements, and what happened to that, because we have done a finite element analysis with the from the CT scan data, find mass models and solid models, and we tried to make prototypes of the implants, and we implanted inside the model and given a different forces in the different directions and get an analysis, FE analysis, where we can come to know where the stress and strain is coming more. So in this massless model, is it possible?
Yes, doctor. It is very much possible. Traditional finite methods, of course, start with creation of a mesh. So once you do a CT scan and get a CAD geometry ready, the first step that a typical finite element solver does is to have a mesh done, right? Once you
So
get a
which
finite
software
element,
you're using, ANSYS or Ideas, or which software you're using?
yeah, we call it SimSolid, which is there on the
Okay,
slide over here.
okay,
And what is special about SimSolid is that you don't have to create a mesh. It is a
okay,
meshless software. So there is a technique called as um, theory of external approximations, right?
okay,
It is an extension of finite element analysis by which you don't have to create a mesh. The whole idea of creating a mesh is to basically generate what we call as a stiffness matrix of the entire geometry, which
yes.
will eventually go ahead for doing the calculations of the various forces, stresses, displacements, and
Yes,
all that.
on the different nodes on the
Correct.
different nodes. Yeah.
Correct, correct. So you don't have to create a mesh, and that is the very reason that this particular tool is very fast. Because
Okay.
most of the finite element tools, once you create a mesh, especially of these complex structures, it will take a long time to run simulations. So
Okay.
therefore, even if you have such a complex geometry as you see on screen, you can still run the analysis using SimSolid.
What is the cost of this software, SimSolid?
Yeah, SimSolid, we typically sell this as part of a perpetual license or an annual lease license. Of course, if you're interested in the tool, we can definitely have a discussion.
Okay.
I'm not
So
aware of that because
it is made by you or it is made by someone else?
it is from Altair. So Altair
Okay.
designs and develops these tools. So it is from Altair. Yeah.
The part you use and pay is model, is that available, or you have to buy the whole software?
Yeah, so the software SimSolid comes as part of a package, and
Okay.
based on what are the different tools that you want to use from that package, it is based on token system. So SimSolid takes a
Okay.
certain tokens to run the simulation. If you are interested in the other tools, like I mentioned earlier,
So
you can do a lot of.
it allows to make a model also. You have to make a model in a different software, and then you have to go for simulation here.
Correct. Yes, you need to generate that model. So that model
Yeah.
model can be generated in a different CAD
For
tool.
that, which software you use to create a model?
Of course, we rely on third-party CAD tools.
Pro E.
Yes, Pro is one of these tools. There is
Okay.
KTR, there is Unique Graphics, and all that. Yes.
Okay. Fine. Fine. Thank you. Thank you.
Thank you, doctor.
So your presentation is over, Sushil, or
Yes,
it's still
yes,
to
my
It is
continue?
over.
Okay,
presentation is over.
great.
Yeah.
So here was Dr. Naveen Thakkarji. He is the honorary secretary for Indian Orthopaedic Association. So thank you so much, sir, for your presence. It's
Thank
always
you.
it's an honor to have your presence also with your presence in the morning, in spite of a very tough schedule that you are
Yes.
actually in. You've been traveling continuously.
I was at Goa. Yeah. Right.
You're in Goa. Thank you so much, sir. I mean, it's a pleasure to have you on board. I will also like to officially also introduce you to Dr. Jayesh Balare. Dr.
Yes.
Jayesh Balare, sir, is actually the institute chair and the chemical departmental head from IIT Bombay. Does a lot of
Oh.
work in tissue engineering, and also soft tissues, sir, hard and soft tissues. We had a great presentation that we could. I mean, he could spend some good time in terms of in both the tracks sharing the insights, because there were audiences, they were differing.
They help a lot in tumor prosthesis to Dr. Agarwal and all that,
Yes,
making the tumor
Yes,
prosthesis all that.
yes, sir.
IT
So
Pawai
yeah.
has
So
helped a lot.
thank you. Thank you very much, Dr. Naveen Thakkar, and we look forward now to looking at some bioresorbable materials as well. So my question,
yeah,
I had a question with respect to the Altair software. There was a mention of modeling of resorbable materials, but is the chemistry of the bioresorbable materials built into that software?
yeah. Sushil, are you there?
Yeah, sorry. I missed the question. I'm sorry. I'm very sorry.
Yeah, yeah,
Sir, can
Sushil,
you
this
repeat?
is Sushil, this is Jayesh Bellare from IIT Bombay. We work with bioresorbable materials. So, and you mentioned that in one of your case studies, but I didn't see whether, I mean, I couldn't understand whether the chemistry of the degradation, the biodegradation, is built into your models, and that example was of of a standard titanium alloy, right? So, where is the bioresorbable part of it, please? Thank you.
Yeah. Well, doctor, thanks for the question. Of course, the chemical analysis is not done within the tool, but the wear and tear with regards to how this particular implant reacts with the human body, that wear and tear can be modeled and simulated. I hope
Okay, so it's wear
I answered that
analysis
question.
of metal. Yeah, so it's metal wear
Correct.
analysis. Uh,
Absolutely.
okay, all right. Thank you.
So it
Also,
is a wear
I was
analysis of the different forces acting in the body, muscle forces and everything that can be calculated.
Absolutely, sir.
Okay, fine. So
Yeah.
that
so
algorithm is there with you. Okay.
Yeah.
no.
Yeah. Yeah.
So it's an AI-based tool that you're using, because I saw that in your brochure, which has already been uploaded. So it's an AI-based tool, Sushil, that you're using, so that everything can be
Yes.
measured as per
Right.
data.
Yeah. Yep. Yes, Dr. Shubhu. Yes.
Yeah, good. So great. I think it was a great session, Sushil. I think a lot of information on Dr. Naveen sir. We had a very good session covering all the aspects, maybe material science. So
Yes.
Dr. Claudio Soto is also there sharing his insights on anti. We did have a session last on the
Yes, I
subject.
could not join because I was busy with the Orthopedic Trauma Association of Europe, and there was a webinar, and I had
Right,
presented one case there. So two
right, right,
faculties from US and Europe they were there. So we were
right,
busy there. Yeah,
right.
sorry.
So what we did is we covered.
Dr. Abhijit here,
Yeah, good evening,
representing
sir.
the Gujarat and Indian Orthopedic Association both.
Good evening,
He's
sir.
doing a lot of work in 3D printing and all that.
No,
Yes,
sir,
sir. Good
and
evening, sir.
I take that privilege and an opportunity also to honor his effort. So what
Yes.
we are doing is we have this 3D Graphy Medical Award, sir, and we will be just joining in that session. Subsequently, it's a panel. We will be just starting, and we are so privileged to really acknowledge some great minds, skilled minds, and also technology respondents who are doing some great work, sir. And it's a privilege to do that in terms of acknowledging it, because 3D technology, even by the end users, needs to be acknowledged for the good effort, so that that particular community also gets to know about the technology in detail, may it be orthopedics or may it be maxillofacial or orthotics or prosthetics. So that's been our conscious effort, sir. Thank you so much, gentlemen. Sir, I would
So
need your concluding.
you are doing a big yagna.
Thank you, sir. Thank you so much. Thank you, sir. I mean, it's an honor to have all of you actively participate. I'm just a catalyst, just trying to knit everybody together to take the course forward. Everybody has a role to play,
Yeah.
so that's what we do. So thank you so much, sir. And I would need your conclusion statement, sir, and then we will move to the 3D Graphy Awards room.
Here you want a conclusion? Here
Please, sir,
it is
from the
better to
session.
get conclude from the Dr. Satu.
No, no,
I think
everybody. We will get
everybody.
the
Okay,
inputs coming from everybody. Yeah, yeah.
okay. The probably I think that here the session was future in high precision sarcoma surgery, and here Dr. Abhijit must have contributed a lot because he's doing so many tumor processes and he's doing customized implants getting cleared and everything. So it have been a good session. So we are thankful to all the contributors.
Thank you, sir. Thank you. And Dr. Jayesh Ballari, sir, your thoughts in terms of your experience. You've been really actively sourcing information, which was very very useful for many of the doctors from the last session, track 6 also and track 7 also. Thank you, sir.
Yeah, and yesterday also. But anyway, thank you. I think it's been wonderful. We've covered a lot of ground on the clinical side, on the material side, on the software and simulation side. So I think all these specialties need to come together to really deliver. And I can see good advances, especially the meshless simulation, the newer antimicrobial materials, including copper and other such materials. So I think, and of course, ultimately we are here to serve patients and through doctors and surgeons. So our hats off to them. Thank you, Shibu, for bringing us all together. Bye
Thank you,
bye
sir.
now.
Thank you so much, sir. Thank you. Thank you, Sushil, and thank you, Dr. Abhijit Salunke. Thank you, Dr. Claudio, and
Thank you very
very
much.
importantly, thank you so much, Dr. Naveen Thakkar. Have a wonderful day. Thank you so much.